But yes, thanks so much everyone for coming to spend an hour discussing humanist alternatives with Frieda Afary, who of course is has written a book over socialism and feminism, has a master's in philosophy, is a part, I mean, we first met through organizing work after the election of Trump, national coalition organizing, and it's been so great to see Frida continue political education that we see as so necessary, especially in a moment right now where a lot of people are trying to put together the pieces of what is going on and what is our way forward. So without further ado, I'll give it up to Frida Afary.
Thank you so much, JJ, for co-hosting and your organizing work and your activism and your thoughtfulness. I really appreciated our communication. So I am delighted to be here with you tonight for the 5th class in the series on humanist alternatives. And my presentation will be about 35 minutes, and then hope to have a lot of discussion, questions, comments. In this training course, we have been exploring alternatives to capitalism from the vantage point of humanism, the idea of humanity coming together around universal emancipatory concepts and using their potential for reasoning, communication, and empathy to solve problems. We have argued that humanism is the antidote to fascism's rejection of reason and fascism's embrace of naked capitalist exploitation. No topic is more in need of a humanist approach than healthcare. Even before the second Trump administration's blitzkrieg on our human and civil rights, and even before the COVID-19 pandemic, the US had a higher mortality rate and a lower life expectancy, not only in comparison to other wealthy countries such as Britain and Canada, but also poor countries such as Kosovo, Albania, Sri Lanka, and Algeria. The average life expectancy for people in the US has been falling, even though this country has spent a higher share of its gross domestic product on healthcare. Not to mention that it's the richest country in the world. The US also has one of the highest maternal mortality rates among developed nations, and that is over 20 deaths per 100,000 live births. But among US Black women, the maternal mortality rate is 3 times higher. The majority of deaths in the US are caused by chronic diseases, such as heart disease and cancer, liver disease, as well as unintentional injuries. Most chronic diseases are related to poor diet, smoking, alcohol and drug use, lack of exercise, poor housing, environmental pollution, and lack of access to proper health care. The COVID-19 pandemic, which led to the deaths of more than 1.2 million people in the US, has also killed anywhere from 7 to 13 million people globally, according to The Economist magazine. The pandemic showed the inadequacy of the public health system in the US and throughout the world. It disproportionately killed the poor and people of color everywhere. It greatly damaged the educational and employment advances made by women. It also showed that we are definitely not prepared for the next pandemic. And that is not a hypothetical question given the latest spread of the bird flu. To this day, we do not definitively know the source of the coronavirus that started the COVID-19 pandemic. While scientists claim that it came from wild animal carcasses in a Wuhan market in China, more recently, most scientists believe that the virus was a result of dangerous lab experimentation with bat viruses at the Wuhan Institute of Virology in China. Although that was a rumor, there were sources that were claiming that, but the majority of scientists were not in favor of that possibility. They didn't think it was really entirely possible. They didn't think evidence showed it. But now, apparently, the majority of scientists really do think that that dangerous lab experimentation with bat viruses at that Institute of Virology was the source of the COVID-19 virus. The revelations about a deliberate cover-up has led to more skepticism among the public. And I'm saying this as someone who didn't believe this claim several years ago, but I read an article by Zeynep Tufekci in the New York Times. Zeynep Tufekci is a highly respectable writer, writes about science and other issues. And I thought, if Zeynep Tufekci argues this and shows evidence for it, then maybe we should be talking about it. As far as women's reproductive rights are concerned, there have been major losses in the US. Prior to the June 2022 US Supreme Court decision, which took away women's federal right to abortion up to the 6th month of pregnancy, women's abortion and reproductive rights gains had been under attack and consistently eroding at various levels in various states. Maternal and infant mortality was and continues to be higher in the US. I'm sorry, not only higher in the US, but higher in the states that have the most stringent anti-abortion laws. In various states, even a miscarriage is now considered a crime for which both the women and medical professionals involved can be imprisoned. Concerning access to healthcare, the 2010 Affordable Care Act, or Obamacare, which has been revised over the years, has marked a step forward. As of early January of 2025, before the start of the second Trump administration, over 24 million Americans, or the highest number since the Affordable Care Act went into effect, had registered for health insurance as a result of this law. This act allows those not low income enough to qualify for Medicare or Medicaid, and those not high income or not insured through their employers to be eligible for government subsidies to buy private health insurance without being refused on the basis of pre-existing conditions. It also covers 10 essential health benefits, such as hospitalization, maternity, newborn and pediatric care, prescription drugs, lab services, rehabilitative, preventive, and wellness services, as well as mental health. It does not cover dental health, however, and so many other services. But these are the 10 that the Affordable Care Act considers essential health benefits. In addition, over 72 million people, including many children and disabled people in the US, are currently on Medicaid, which is a form of health insurance for people whose income falls under the federal poverty level, and that federal poverty level is approximately $15,000 for a single person, approximately $20,000 for a family of two, and approximately $32,000 for a family of four. The above forms of health insurance coverage, in addition to the coverage that millions get through their employers, are still defective in many ways. The health insurance companies charge high deductibles, and we all know this. We all experience this. Health insurance companies charge high deductibles. The insured get rejections from their insurers for many of the services that they need. Millions are saddled with out-of-pocket costs that insurers do not cover, and many go into bankruptcy because of medical debt. The cost of home care for most elderly people is also not covered by insurance. Many families go bankrupt to pay for caregivers at home for elderly and sick relatives, or to pay for nursing home care, which is also inadequate and often negligent. So in reality, class, race, and gender discrimination continue to determine who gets what type of care and who gets to live a long and healthy life. The level of public anger about the cost of healthcare can also be seen in the public's sympathetic response to the killing of a United healthcare executive by a disgruntled youth, Luigi Mangione. Now, at the same time, the efforts to promote a single-payer universal healthcare system without deductibles and without co-pays and without discrimination based on class have all failed. And this solution, the idea of a single-payer universal healthcare system, is not even on the agenda of the Democratic Party. Okay, so this is all about healthcare in America prior to the second Trump administration. Now, what we're seeing with the second Trump administration is that this inadequate and defective system is being completely dismantled and replaced by policies that will have catastrophic consequences. Globally, the US Agency for International Development, which provided a large portion of health and education assistance to millions in the global South, has been dismantled. This has resulted in 50 million women and girls losing access to birth control, and millions losing access to HIV medication, as well as many other treatments, educational and environmental programs that truly save lives. The Trump administration has appointed Robert Kennedy Jr., a known anti-vaccine propagandist and promoter of disinformation with zero qualifications in the healthcare field, as the Secretary of Health and Human Services. They've appointed Dr. M.L.I.S, another known promoter of disinformation and multi-million-dollar businessman and corporate lobbyist with ties to medical insurance and healthcare companies, as the head of the Centers for Disease Control. So these two are our health leaders in this administration. Kennedy's dangerous disinformation about vaccines has contributed to distrust among many parents who are not vaccinating their kids against deadly viral diseases that have been vanquished years ago. Thus, we're seeing new epidemics of contagious diseases such as measles, which can be life-threatening and do lifetime damage to those who contract it and survive. Then, of course, we also have massive budget and staff cuts in the federal health workforce. The National Institutes of Health and Centers for Disease Control have the cuts that they've experienced have already resulted in the loss of essential healthcare workers and an end to research on critical fields such as vaccines, cancer, HIV, women's health, Alzheimer's, and others. In addition to all the above cuts, the Trump administration, with the help of congressional and Senate Democrats, has passed a budget that aims to cut almost $1 trillion, mostly from the Medicaid budget, in order to partially make up for a $4 trillion tax cut for corporations and the rich. And that's an extension of the 2017 tax cut in the first Trump administration. So now that we've covered the range of the assault on healthcare in the US and its global effects, let's talk about where we are in the US with any humanist vision of healthcare. Oh, there it is. Okay, thank you, JJ. Would you please move the slides forward to the, okay, that's the table of contents. And then the next slide, please. Okay, one more, please. And okay, this is what we just covered, and one more, please. And one more, please. Okay, so this is the second part of the presentation, a humanist concept of healthcare. Next slide, please. Thank you. Okay. The readings for today's class included a recorded presentation on medical ethics by Dr. Michael Knight, who is a member of the American Medical Association's Council of Medical and Judicial Affairs, and an academic paper called A Philosophy of Health by Julian Sand and James Prochaska, who are both cancer prevention and research specialists at the University of Rhode Island. So Michael Knight has, who is a medical doctor, has restated the American Medical Association's 4 pillars of medical ethics. They are the following: beneficence, or doing good deeds; non-maleficence, or not doing harm; autonomy; and equity. And Knight has also emphasized that according to the American Medical Association Code of Ethics, if these principles are not practiced by a healthcare institution, it is the responsibility of physicians to take an active role in promoting change, to adopt new strategies and policies that are about equitable care for all. And then, considering the other reading that we had for today, the cancer research specialists that we read, Julian Saad and James Prochaska, believe that a holistic philosophy of health requires health at the physical cellular level, at the individual behavioral level, and the social and societal level. That in order to have health, you have to have all 3 at the same time in a society. So this is the basis for what they describe as functional medicine. So these are definitely humanist and elevated concepts which should be followed. Next slide, please. However, in reality, the practice of medicine in the US today is otherwise. In the words of Carl Elliott, who is an author and medical ethics teacher at the University of Minnesota, and these are his words, a central aim of medical training is to transform your sensibility. You are taught to steel yourself against your natural emotional reactions to death and disfigurement, to set aside your customary views about privacy and shame, to see the human body as a thing to be examined, tested, and studied. One danger, and this is Carl Elliott continued, he says, one danger of this transformation is that you will see your colleagues and superiors do horrible things and be afraid to speak up. But the more subtle danger is that you will no longer see what they are doing as horrible. You will just think this is the way it's done. And the reason I quoted that in full is that I just thought that was such a powerful statement about the way our medical system operates and how dehumanized it's become, or it is. Another doctor, Lindsay Ryan, who is an associate physician in the Department of Medicine at the University of California in San Francisco, has written about the enormous stresses that affect doctors, nurses, and other healthcare professionals who care for low-income, homeless, and other vulnerable populations. Doctors and nurses are not allowed, or rather are allowed very little time to talk with patients during visits. Some doctors and many nurses and other medical staff also spend much time calling various agencies and insurance companies to get payment approval for necessary procedures and to beg, literally beg, for basic services, including resources like adequate food and housing for their patients. So this is some of what Lindsay Ryan talks about. While many doctors in the US have lucrative jobs, doctors also have a high suicide rate in comparison to other professions. Each year, 300 to 400 physicians die by suicide. And nurses also have a high burnout and high suicide rate. So let's not forget that. They too are stressed out and burned out. So the suffering is on both sides, but of course it's unequal. Based on the facts and concepts discussed so far, next slide, please. Thank you. So based on the facts and concepts discussed so far, we can argue that a humanist alternative would need to address both the issue of unequal access to care and the issue of the quality of care and lack of a holistic view. So a humanist alternative would also require more time for caregiving and conversation interaction between patients and healthcare professionals. Clearly, we do need a universal healthcare system that provides quality care to all. However, such a healthcare system would need to oppose not only for-profit healthcare, but also speed up and the capitalist fragmentation of the human being. So what I want to emphasize is that the problem with the existing medical system is not only unequal access and discrimination based on class, race, and gender. It is not only capitalist profit seeking and its unequal distribution of resources. More fundamentally, the capitalist medical system fragments human beings into body parts and does not see the whole human being as body, mind, and heart united. It also does not allow enough time to address the specific needs of each individual. Instead of addressing root causes of problems, it primarily addresses symptoms of illnesses through the use of medication and surgical options. In the first class in this series, the class on labor and economy, I did talk about how the fragmentation of the human being under capitalism is rooted in the capitalist mode of production. A mode of production which is based on alienated, mechanical, mostly mindless labor. Here, I would like to add that breaking with capitalist alienated labor in favor of a humanist alternative can have three very specific beneficial consequences for the practice of healthcare. First, if a social average production time determined behind the backs of producers does not dominate the process of production, then the idea of reducing time spent with a patient to a minimum will no longer dominate the doctor-patient or nurse-patient relationship. Each patient will get the time that they need based on their individual needs and conditions without the doctor or the nurse and the patient being rushed and overworked all the time. So that's the first one. Secondly, if the system of production is not based on the extreme separation of mind, body, and heart, then humans will not be viewed as body parts, fragmented from each other, but rather as whole human beings whose health requires a holistic understanding of the person. If the goal of production is not the expansion of monetary value as an end in itself, then medicines and surgical procedures will also not be seen as means for making profit, but as treatments when needed. Instead of simply addressing symptoms of problems with drugs and surgery, time and effort will be spent on understanding the person as a whole and finding treatments that might be more time-consuming, but also more effective. So that's the second beneficial effect. And thirdly, if both labor time and leisure time become thoughtful and meaningful, people will feel that they have more control over their lives. More satisfying jobs will have a great influence on human health. There will also be more time for enjoying healthy and nutritious meals, exercise, healthier human relationships. So those are the three beneficial consequences of breaking with the capitalist mode of production, but specifically for concerning healthcare. For all the above reasons, I would say that developing a humanist alternative to capitalist healthcare, or what a California healthcare activist, Maureen Cruz, calls wealth care, developing an alternative to that demands the transcendence of capitalism. Such a transcendence is not simply the abolition of the private property of the means of production and abolition of market mechanisms. It is the abolition of capitalism as alienated labor. It is not simply about changing the distribution of wealth and income. It is also about human beings having control over their lives and work and leading a thoughtful and meaningful existence, which would greatly improve their health. Okay, next slide. Next slide. Okay, last part. What can we do now? And here I have a list of six items. Of course, there's so much more to say. Actually, seven items. This is what I think we can do now. But of course, you're welcome to suggest your own ideas and proposals. So first, protest against the Trump administration's massive federal budget and staff cuts. Its $4 trillion tax cuts for corporations and the rich. Its cuts to the US Agency for International Development, which are already causing more deaths from hunger and disease in places like Sudan and Afghanistan, among others. In some cases, courts have ordered the restoration of cuts, but the lawless fascist Trump administration is refusing to abide by these decisions. Various social justice and labor organizations have also called for a national day of action for single-payer healthcare on May 31st. So let's participate in that national day of action. Second, ask why it is that the richest country in the world, or in the richest country in the world, we do not yet have single-payer universal health care. It is not only because of the lobbies of powerful pharmaceutical and insurance companies and other oligarchs determining governmental policy. The truth is that a large part of the US public is also against single-payer universal health care. By a large part, I mean this. According to Gallup polling statistics, 57% of the US public believes that the government should ensure health coverage for all. However, over half of those believe that they favor private insurance. So let's take a look at that fact. What this means is that there is a healthy skepticism about handing over healthcare to state authority. The view is that if we have single-payer universal healthcare, that would mean handing over healthcare to state authority. So faced with this reality, I think we need to address the misconceptions about choice and quality when it comes to private health insurance and capitalism's focus on the maximization of profit. At the same time, we cannot ignore the fact that government-run health insurance also operates on the basis of capitalist mechanisms of cost cutting. So it's not as if switching to a government-run health insurance system, that mechanism of cost cutting will just disappear. It will not. Single-payer universal healthcare is, of course, better for all, but it's a short-range solution while we work on how to transcend capitalism itself, or at least that's what I argue. Okay, third, define healthcare as a human right, not only the right to equal access to health resources, but also the right to be treated as full human beings, mind, body, and heart all together. The right to not be fragmented into body parts or turned into guinea pigs for testing new drugs and surgical procedures. 4, address the skepticism of vaccines by challenging disinformation, but also be mindful of the ways in which our capitalist medical systems drive to maximize profits does not allow for transparency or full transparency about the dangers of certain drugs and experimentations. In the case of vaccines, some pediatricians are now offering to give them safely over time and without overwhelming a child's immune system. I think that sounds like a good idea, because I am definitely in favor of vaccines. But if this is a concern that parents have, that giving a child too many vaccines at the same time overwhelms their immune system, well, let's spread them out. But more important is the question that capitalism doesn't really allow for full transparency. So people have a right to be skeptical. But of course, the extreme right uses that to promote disinformation and turn people against vaccines altogether. Okay, next is become knowledgeable about holistic fact-based treatments, which include nutrition therapy, supplements, vitamins, exercise. So all of these have a place in our healthcare system. It doesn't mean that medications are not necessary or not useful or helpful, but we need to have a holistic view. Expose and oppose the so-called pro-life movement as an anti-life movement that wants to promote patriarchy, take away women's right to control their own body, and turn women into baby machines. The so-called pro-life movement does not care about the health and well-being of mothers and infants if they are poor or people of color. So let's talk about that. Let's talk about what being pro-life really means. And let's talk about the fact that in states that have the most stringent anti-abortion laws, they also have the highest maternal mortality rate and infant mortality rate. Let's not even use the word pro-life anymore for the anti-abortion movement. Let's not allow them to abuse that concept. And finally, do not limit your expressions of protest to demonstrations and picket lines. The more we have of demonstrations, picket lines, the better. But also go to your public library, go to your parent-teacher association, neighborhood recreation center, community center, farmers market, and offer to organize community discussions on these issues. Call into your local talk show hosts, write letters to newspapers and websites. Discuss these issues with your friends and relatives on Zoom calls. Speak out, look for any opportunity to discuss these issues, because going back to the beginning of this presentation about the idea of humanism, meaning that we come together around emancipatory concepts and use our potential for reasoning and communication to solve problems. That is really fundamentally the way to combat fascism. Fascism's rejection of reason, fascism's embrace of capitalist exploitation has become so entrenched in American society that we cannot fight it unless we really engage in these discussions in a deep and thoughtful manner. And I hope that this presentation has contributed to that. I look forward to your questions and comments. JJ, would you please go to the next 2 slides? So these are the references. I found some really excellent articles for this presentation. So when I post the slides on my website, you're welcome to take a look and really explore some of the references yourself. And next slide, please. And if anyone needs to contact me, this is my contact information. These are my websites. This is my book. And I look forward to